What to do if baby bites while breastfeeding. I hear moms say, I'm going to breastfeed until my baby gets teeth. Well, did you know that lots of babies never bite? And if they do, I have some steps on how to correct that. Today we're going to go over reasons why baby might bite, how to stop the behavior, and what to do if you have nipple pain caused by baby's teeth. Are you ready? Let's go. Hi, Mommy. My name is Mary Cahill, and I'm a certified lactation counselor. I help mommies like you to be confident and successful in their breastfeeding journey. Babies start to teeth somewhere between 4 and 7 months old. With lots of patience, mom can usually get baby to quit biting in just a few days. The most common reason that I see that babies bite is from teething. Also, a baby might bite if mom has a forceful letdown. Or baby could be biting just because they're bored or they're playing or they want mom's attention. If your baby is extra drooly or super fussy, that can be a sign of teething. Now, you may see those signs weeks before you ever see a tooth. And baby can have some teething pain today and then be fine for several days. Giving baby a rubber teething toy to play with and chew on can really be helpful in massaging baby's gums. You can also take a clean washcloth and dip it in breast milk and freeze it for about a half an hour and rub that on baby's gums or hold on to it and let baby chew on it. That's good to do just before you nurse baby so their gums are numb and they're more comfortable when they're nursing and hopefully not bite you. If your doctor's good with it, infant Tylenol really helps too. There's some numbing gel that used to be popular and you really don't want to give that to baby. It has some serious health risks associated with it. Some babies will bite down to control the flow of the milk, especially if mom has a forceful letdown. If you think that might be you, I have a video on how to know if I have a forceful letdown, and I'll link that right here. Sometimes babies will bite because they're bored or they're playing or they just want mom's attention. Talking to baby will really help to keep them focused, or if you have a little toy or a breastfeeding necklace, and that's a little tactile necklace that helps baby to have something to play with to keep them focused on the breast. And I'll put a link for those below, but it's something you can make yourself or have a little toy clipped right to your shirt to keep baby focused right there. If your baby bites you, you want to take baby off the breast and say no, or that hurts, mommy. If baby cries, you want to comfort baby, but wait a few minutes before you let baby latch again. Now, baby's probably done nursing if they've bitten you. The reason why you want to comfort baby is because you don't want baby to get upset. If baby perceives something is upsetting at the breast, then they may go into a nursing strike, and that can be pretty difficult to overcome. Watch baby as they're nursing. If they start to slow down at the breast and they look like they're about done, you might just go ahead and take baby off the breast, or remind baby, no bite. If your baby were to bite down and not let go of your breast, it can cause more damage to try to rip your nipple out of their mouth. You can usually use a finger and put it between their gums to help them to release. Now, I've heard it taught before that if you'll push baby's face into your breast, then they can't breathe and they'll let go of your breast. I really don't recommend that. That's a big stress for baby, and it can cause baby again to go into a nursing strike. Getting baby in a proper breastfeeding position will make it so baby cannot bite down. I have a video on how to nurse my baby without pain, and I'll link it right here if you'd like to watch more. But just to go over the basics, baby should be their nose in line with their belly button, so their head's not turned at all. Baby's body should be tied up against you, so when you're nursing, if baby's tummy is turned up at all and their head has to turn, they can't get their mouth quite as wide open if their head is turned. The reason why you want baby's mouth wide open is because the human jaw is so powerful if it can bite down, but it's not very strong at all if it's opened. So if there's a lot of breast tissue in their mouth, then they can't bite down too easily. Also, when baby's nursing and their mouth's open wide, their tongue goes over their bottom teeth, and that makes it nearly impossible to bite down. As baby gets a little older and a little heavier, they start to kind of weigh down and slip out on your nipple. So you may need to get some pillows and prop baby up again, just like you did when they were a newborn. You can also try a little different position, so baby's sitting more upright so that they don't pull and slip out on the nipple. If baby's in a good breastfeeding position, but still their teeth are rubbing against your breast, what you can do is sandwich your breast. So to sandwich, you want to push in towards your chest wall and give a sandwich. It just takes the pressure of baby's teeth from rubbing up against your breast. You want to be sure that your fingers are outside the areola, not in the way, or baby won't be able to get enough breast tissue in their mouth to be latched correctly. So sandwich. You want to sandwich the same direction as baby's mouth. That will really help. You can also apply a nipple cream that's safe for baby while you're nursing, that will give some slip action against their teeth so it won't be rubbing and causing you quite so much pain. If baby bit you and it's causing you a lot of pain or it broke the skin, then you'll want to apply cold compresses right away. Taking ibuprofen will help with any inflammation and with the pain. If it hurts too much to nurse baby, then you'll need to pump. You'll need to pump so you can keep your supply up, but also so you don't end up with a clogged duct. If pumping is too painful, hand expressing can be much more comfortable. If your baby is biting, I am so sorry, Mommy, that you're going through this. Please remember that this is a phase and it will get better. Let me know in the comments how it's going for you and your baby. And if you have any questions, I'll try to get back to you just as soon as possible. I hope this video was super helpful for you. Can you let me know what things you'd like me to cover in future videos? Thanks a lot, Mommy. You got this.